Good evening, everyone, and welcome back to the Canadian Concussion Center's webinar series, which is sponsored by LiUNA, the Labor's International Union of North America. I'm Leslie Rattan, and I'm pleased to be moderating our webinar series, which has been developed for people that have suffered from concussions, their families, caregivers, as well as healthcare providers. And if you've been with us before, you know that each session we're focusing on a different aspect of concussion. And that includes an expert speaker to begin with for the first half, and then it's followed by a question and answer period for the duration. And our sessions are continuing to recur every other week live on Tuesday evenings from 6 to 7 p.m. So tonight is our 21st session. If you've missed any of the previous sessions, you can access those on the Canadian Concussion Center's website. And for this evening's session, just keep in mind, if you have any questions, you'll see at the bottom of your screen on the far right, there's a Q&A icon. This is where we would ask that you enter any questions that you may have for Dr. Reid. If you're having any technical difficulties, please enter those into the chat. In addition, keep an eye out in the chat. Christian is going to be posting a PDF of the presentation if you are wanting to look at that. And also, if you have any technical difficulties, he can get back to you if you enter those concerns there. Also, we're just going to run a short poll to gather information on who our live viewers are. So, Christian, if you could just bring that up. We're just trying to get a sense of who is out there and who is watching. So we'll just give you a second to do that. Helps with our planning moving forward. Okay. So for this evening's session, I am really pleased to introduce Dr. Nick Reid, who's going to be presenting, as you can see, Returning to Learn After Concussion. And Nick is an associate professor in the Department of Occupational Science and Occupational Therapy at the University of Toronto, where he is the director of the Oak Concussion Lab. And he also holds a Canada Research Chair, Tier 2 in Pediatric Concussion. His work focuses on research, educational, and clinical programming specific to youth and concussion. And with that, I'm going to turn it over to you, Nick.
Thank you so much, Leslie, and thank you everyone for joining us tonight. It's a real pleasure to be a part of this session and to share some insights, but hopefully more so some links and resources for all of you to build your toolbox related to returning to learn after a concussion. So I have an ambitious amount of content in the presentation tonight, and we'll see how we do, but I want to make sure we have plenty of time for Q&A at the end. So save those questions, put them in the chat, and I'd love to have a discussion. And you can always reach out to me in other ways. I'll make sure I put up my contact information at the end of the presentation, and happy to connect in any other way. I'll just reiterate, and Leslie mentioned it, and I see it in the chat. A PDF of these slides are available. And, you know, I think one of my goals tonight is to give you lots of links to great resources that exist for you to build your toolbox. And all of those links are hyperlinked in the PDF. So please take a look at that PDF, save it, put it in your files, and hopefully it allows you that opportunity to access some good information down the road when you need it. Okay, so let's dive in. So just to start, some of my disclosures, the grants and research funding that I hold, as well as my link to a clinic in the community, 360 Concussion Care. To let you know who I am. So you heard it in my bio, but I'm an occupational therapist by clinical background. And as an OT, our mission is really to help people get back to the things they need, want, and love to do in their lives. And for me, it's helping young people, for the most part, get back to life after concussion, including returning to the school environment. I spent most of my career to date at Holland Bloorview Kids Rehabilitation Hospital, where I supported the creation and direction of concussion clinical programming, research programming, and some really great efforts in the community for community outreach and education. And I mentioned my link to 360 Concussion Care for some of my clinical pursuits. But I now spend most of my time fully based at the University of Toronto directing our Oak Concussion Lab, which stands for Outcomes, Advocacy, and Knowledge. And as Leslie mentioned, I hold a Canada Research Chair in Pediatric Concussion, which gives me the opportunity to explore many different topics related to supporting people to best support young people when they have a concussion and also to prevent that injury in the first place. So I'm thrilled to share some of my insights with you all tonight. And again, thanks for having me. So what will we touch on tonight? Well, the goal is first, a little bit of me getting on my soapbox as an occupational therapist and thinking about this idea of focusing on function after a concussion. So not just the symptoms that we experience after a concussion, those headaches or decreased attention and so on, but what do those symptoms mean for our lives and how we're functioning and doing the things we need, want, and love to do. I'm going to give a little bit of context around return to learn after concussion and some of the laws, consensus, and evidence-based documents that promote the focus of for all of us on return to learn and why it's so important. I'm going to share some strategies on, at least from my clinical experiences, some ways to optimally support individuals with concussion get back to the school or learning environment. And then I'll close with a few summary points, some take-home points, or as I like to call them, NIC tips. As I mentioned, there's going to be lots of links and resources shared along the way. And again, you can use that PDF posted in the chat to access those resources through some hyperlinking, which hopefully is a bit more convenient for all of you to build your toolbox. So that's it. That's the plan for tonight. Let's give it a try. So first, a focus on function. As I mentioned, something I really believe in is when we're working with individuals with concussion, like my friend Josh here, we know that concussion leads to a range of symptoms and signs, typically in four main areas: physical symptoms like headaches and dizziness, cognitive or thinking symptoms like decreased attention, emotional symptoms like anxiety in the case of Josh, or could be some depression, and also some sleep symptoms. But what we really want to be aware of and always thinking about is all of these symptoms are going to perhaps impede our ability to engage in the things that are important to us. And for Josh here, it's playing the sport he loves, which is basketball, going to school every day and learning and getting the grades that he wants to succeed in his life. For him, learning to drive the family car is a big part of his life, and doing fun things like jumping on trampoline and just being a young person and all the other leisure pursuits that may be involved in his life. So it's this idea of focusing on function when it comes to supporting individuals with concussion to get back to the things they need, want, and love to do. And of course, I'll highlight here our focus tonight is a really important thing for many individuals with concussion. And that is returning to learn and returning to the school environment. So we'll spend some time tonight diving into that a bit further. Just some foundational pieces that really guide my approach to managing concussion and supporting individuals to get back to the things that are important. And this is taking a biopsychosocial approach where we have biological factors, so the injury itself, the physiology that's going on in the brain and body that's impeding our function and making us feel the way we feel, but also thinking about the social and psychological factors. So from a social standpoint, the support of family and friends or that school culture and environment, that can certainly play a factor in successful return to learn. And also the psychological component. So, how are we feeling and how are we perceiving our ability to re-engage in the things that are important to us? So when you think about this model, the intersection is really that sort of those positive health outcomes. And if we link it to our topic tonight, I think we could say addressing these various factors can really lead to increased school success for individuals with concussion. So what I want you to do now is just reflect on what was or is school like for you, and just thinking about some of those various factors that I mentioned in that biopsychosocial model. So we know that the school environment is very demanding. There's a daily schedule, there's deadlines, there's pressures from family, peers, self-pressure, lots of demands on us in that environment. There's lots of activities, right? So there's lots of doing in the school environment. Some of those are active activities, some of them are passive, often group-based, so we can't really just sort of do our own thing, and sometimes we need to be involved in that sort of that social model. And some of those activities are risky, where we could be at risk for another concussion, and we want to think about that. A big piece that I always like to focus on with my interventions is this idea of the environment. And think about that school environment. It's busy, it's noisy, you're rarely alone. Even things like where do you eat lunch and where do you find some times to recharge that battery can be really challenging in the school environment. So all of these factors need to be considered when we're thinking about accommodations and supports after concussion. So we have Josh, he's had his concussion, he has some typical signs and symptoms, and he's really struggling with returning to school. And what I wanna say is Josh isn't alone. We know from some great work done by a fantastic colleague of mine, Carol DiMatteo out at McMaster University, also a fellow occupational therapist, that within some clinical samples that she's worked with, the majority of those young people were having academic difficulties during their concussion recovery, and even post-symptom resolution. So even after still feeling great, there was still some supports needed in place to bring yourself back up to where you wanted to be academically. So Josh isn't alone. I know many of you on the call tonight, you're not alone, and this is why we all need to work together to best support those with concussion to get back to the things that matter. So school is important and people need help, and that's what we're going to talk about tonight. So the next section I want to talk about is just some of these contextual pieces that really drive, and I think we can view them as facilitators to driving our need to support young people and people, anyone for that matter, across the lifespan, return to learning. So first is, what does the law say? Well, here in Ontario, we have something called Rowans Law, which is named in memory of a 17-year-old female, Rowan Stringer, who tragically passed away as a result of second impact syndrome, or the catastrophic swelling of the brain by second injury to the brain before the previous injury had healed. And I'll just share this link and you can find it in your PDF as well. If there's anything that I think you should watch around Rowans Law and Rowan Stringer, it's this link from CBC where it really amplifies and showcases the messages from Gordon Stringer, Rowan's father, and what he did in memory of his daughter to make sure that those like her are safer down the road, and really push for this law, which is the only law in Canada right now related to concussion. So within the law itself, just a few pieces that are directly linked to returning to learn after concussion. And the law is linked to a mandate within the Ministry of Education that requires all school boards in the province of Ontario to have concussion safety protocols in place. And those include a concussion code of conduct. So how are we as a school environment going to respond and behave related to concussion and safety? A process for removing students with a suspected concussion from a physical activity to get them the help they need. A return to school plan for all of those individuals that are removed for concussion. And also this idea of a process to document and track progress with that return to school plan. Further, there are some educational components to the law, which include education around the impact of concussion on learning and some of the components that need to go into returning to learn. So the laws in Ontario are really on our side here. There are supports in place to make sure that school boards are aware of concussion and have some processes in place to support our students. What does expert consensus say? So meant to be every 4 years or so, concussion researchers and clinicians from around the world gather to create the consensus statement on concussion in sport. The most recent of these statements was published in 2017. There's been some delays in the next version of this due to the pandemic, but there is a meeting planned for the fall of 2022. So there should be some more in recommendations related to this. But if we think about the previous consensus statement, there was 4 key messages that came out that really correspond with returning to learn after concussion that are important facilitators for what we're trying to accomplish here. One is this idea of no more bedroom jail. And what I mean by bedroom jail is after a concussion, locking somebody away in their bedroom or somewhere else where they're resting for long periods of time and not engaging in life. So the newest recommendations are that we want to rest for a short period of time after concussion, about 24 to 48 hours. But after that, we want to start to introduce light cognitive and physical activities that aren't going to make symptoms worse. But if you have symptoms, you can still re-engage in activities. So the facilitator here for return to learn after concussion is this idea that we can return to school sooner and with symptoms. So with some good supports in place, we want to really try to promote and enable individuals with concussion to get back to that learning environment sooner than later. There was also explicit messaging in this statement around gradual return to school, and also this idea of returning to school and being able to function in the school environment safely before re-engaging in risky activities like sport. So finally, a defined focus on getting back to school as part of the concussion process, which I think is a huge facilitator. This idea of engaging in differentiating between risky and non-risky activities after a concussion and getting back to those activities. So we certainly don't want to engage in risky activities where we could have another concussion before we have symptom resolution and medical clearance from our concussion. But there's a whole lot that can happen between risky activities and doing nothing. And school is one of those, particularly if we can avoid unpredictable environments in the school setting. This could be phys ed class or school sports where we may have another concussion. There's a lot of learning and a lot of engagement that can be done that isn't putting you at risk for another concussion. So again, we want to try to re-engage individuals with concussion into the learning environment as soon as we can with appropriate resources. There was also some direction around how long does it take for young people and adults to recover from concussion. And this allows us a little bit more of insight into some realistic expectations for getting back to life, including school. So what does the evidence say? We've heard about the laws, we've heard about some consensus. What does the evidence say around returning to school after concussion? Well, for us, we have the great opportunity to look to some fantastic clinical practice guidelines for concussion, both in the pediatric population, as well as in the adult population. And within these guidelines, there are specific recommendations based on the current evidence that tell us what steps we can take and give us great resources to support that. You see the links on the slide here. Please check these guidelines out if you haven't done so already. The target audience for these guidelines is healthcare professionals, and I know we have some on the line with us tonight to give you some good insight into how to manage concussion in your patients. But there are also some fantastic resources in here that are facing the public and individuals across the lifespan. So lots of great resources in this document, in both of these documents, should you be looking to build your toolbox. So what did these recommendations say? Well, first and foremost, this idea, again, reiterating that we want to get individuals with concussion back into the school environment as soon as they're able to tolerate it. And that means they can still be experiencing post-concussion symptoms. However, we just don't want to be doing activities that are going to make these symptoms considerably worse or put us at risk for more injury. It also speaks specifically to a stepwise return to school plan. So we want to take steps towards full re-engagement in school. And I'll show you some resources in the next few slides that help guide us in that. It also speaks to this idea of temporary accommodations based on symptoms and individual need. And we're going to talk about some of those common accommodations as well in our slides tonight. And finally, this idea of monitoring and modifying the return to school plan. So it's really important to not just create a plan and try to execute it, but on a regular basis, working with individuals in the school environment to revisit that plan. Is it working? Is it not? Do we need to modify it in any way? Or maybe we don't need the plan at all anymore because re-engagement in school has been so successful. Again, I mentioned within these clinical practice guidelines, there's a whole lot of fantastic tools that can be really useful. Things all the way from template letters of accommodation to educational tools like the C.E.T return to school strategy, and some great resources from friends of mine at Parachute Canada that I think everyone would benefit from looking at. So take a look if you have an interest. Some sub-recommendations from these clinical practice guidelines that are important as well is really to avoid the complete absence from the school environment. So again, we want to have some good initial rest after concussion, but we want to start thinking about re-engaging in school sooner than later so that we're not suffering some of the consequences of not being in that environment for too long. And another sub-recommendation is around this idea, again, I'll reiterate it because it's so important. When you are in the school environment, to avoid activities where there is a risk for contact or for the potential to have another concussion. Again, there's lots we can do in the school environment that are not going to put ourselves at risk for another concussion. And we just want to make sure we're taking those precautions to not re-injure when back at school. So when we think about law, consensus, and evidence, there's a lot of facilitators to point us in the direction to, we need to care about this. We need to support individuals with concussion to get back into the classroom and into the school environment. And now it's putting all of those laws and policies and procedures and evidence into practice. So what might that look like? And we're going to spend a little bit of time now just discussing what some of those strategies could be. So first and foremost, and I mentioned this already within our clinical practice guidelines, but taking a stepwise and gradual approach to returning to learn after concussion. From friends at Parachute Canada and C.E.T.S, there are return to school strategies that we can use to help guide us with this. This strategy I'll show is a simple one, which I think is nice to just provide some good direction in a simple way towards that return, where we're taking some steps. And depending on how our body is responding to what we're engaging in, we can advance that engagement in more complex tasks, be it cognitive and physical in the school environment. So what does that look like? It looks like maybe starting in the home environment and trying some cognitive activities, reading or some screen time, then progressing to some school activities. And this could be some homework or some classroom assignments that maybe we've received from our teachers. If we're doing well with that, we can return part-time to school and try to figure out a schedule that's going to be most conducive to feeling well and learning. And if we're doing well, then eventually we can start to return to school full-time and in time remove those academic accommodations when no longer needed. One point I'll make here is it's important when we have those academic accommodations in place to not just remove them immediately when someone's back in the school environment. There may be some catching up to do, and even if you're feeling quite well, there's likely some need for some of those accommodations to stick around for a little while, just to get you back up to the spot that you need to be and in line with your peers' learning. So keep that one in mind as you're planning return to learn. Here's another option of a stepwise return to school plan. This one's much more detailed from our friends at CAT Online at the BC Injury Research and Prevention Unit. And it, again, takes you in a stepwise fashion from the least complex tasks all the way to the most complex tasks. And, you know, we won't spend too much time going through this tonight, but I think it's something you definitely want to look at just to get an idea of how do we break down those return to learn steps and what that could look like in the real world and some good strategies to apply this. One thing I'll mention here is when we look at these stages, it looks very linear, right? So we start at stage 1, if things are going well, then we progress all the way to stage 6. And it's great when things move in that linear fashion, but I would say 99.9% of the time, we're gonna take some steps forward and some steps backwards. And I think that's just something we wanna be aware of, that progressing through these steps doesn't have to be completely linear, and we may go backwards in our stages every now and then and reintroduce some of the supports and work towards that final end goal of full re-engagement. What about accommodations and supports? So these are some ideas from a tool that we've created called School First, and you can find that online, totally accessible with lots of great resources. But thinking about some of the different ways that we can accommodate in the different areas of accommodation. So thinking about the environment that the student is returning to, how can we modify that? Things like providing alternate workspaces with less distractions. I tend to ask individuals that I work with concussion if they're a front row sitter or a back row sitter at school. And if they're a back row sitter, I try to push them to the front row so that we're focusing and using all of our energy on the things in front of us and what we need to learn, rather than all the distractions from the classroom that you may get when you're sitting in the back row. Taking some breaks, decreasing stimuli. You could use some tools like headphones and sunglasses to do that. And just having some time to take breaks is really, really key. Thinking about different ways of accommodating or adapting the work that students would need to do. And this is where teachers come into play and have some great expertise. But thinking about perhaps different ways of doing the work, providing notes with copies and things that can be looked at a later date. And again, just making sure there's some breaks and opportunities to do things maybe at a slower pace, but still work towards the same outcome. A big piece and a huge barrier to returning to learn is assessment and evaluation. And one of the main components of accommodations related to return to learn after concussion can be some flexibility on that assessment and the evaluation. So perhaps there's more time to complete homework. Maybe things are assessed and graded in different ways. So rather than a written paper, maybe that's a more of a dictated explanation of sort of what your thoughts are and what you may have learned within an assignment. And just this idea of weighting assignments differently to accommodate and to make sure that that student is set up for success. So lots of different options here. What I will mention is that these approaches to accommodations are individualized. So it's not a one size fits all where all accommodations are going to be helpful for everyone, nor does everyone need all of these accommodations. So really trying to get a sense of what that individual needs and what they respond to and create accommodations according to that. Related is this idea of adjusting these accommodations over time. So again, taking some away if not needed, maybe reintroducing some new ones if they are needed, and just some trial and error along the way to best support the student. To do that, however, we really need communication with the school, and we need a point person in that school environment, which I'll touch on as we go along. So check out the School First resource if you have an interest in any of these different accommodations and ideas. The resource itself was created for teachers and school staff to best support students. However, I think the content in this resource is useful to anyone who's trying to support or return to learn after concussion. Just a few of my favorite accommodations. This is actually one of my tools that I use clinically, some of my templates around return to learn letters. But this idea of having a contact person or a point person in the school is going to be so important. That could be a vice principal, a guidance counselor. At the post-secondary level, that could be an accessibility services offices coordinator. And really just having those extra check-in meetings with that point person so they can help you, they can advocate for you, and you can just have someone in your corner. It goes a long, long way. Some of my favorites as well are having some rest breaks where students can be excused from class if their symptoms are exacerbated or if they're not feeling well. This avoids students from having to go home and disengage from the school environment, and much more preferred to have a bit of a rest, recharge, start to feel well, and then re-engage in school that day. I mentioned the preferential seating, front row sitters versus back row. And a big piece, especially at the high school level, is eating lunch and where you do that. And the cafeteria is usually full of noise, full of distractions, and perhaps the school can allow for a distraction-free eating area and with 2 or 3 friends. So not totally isolated, but with a few friends to help you stay engaged and stay social. Energy conservation. So this is an analogy I use often with young people and families, but I think it applies to everyone across the age span. But when we have a concussion, we can think about our gas tank, which is our brain and body, being half full. So everything we do in our day uses fuel, but when we have a concussion, we have a massive energy crisis going on in our brain where it's going to use lots of resources to try to heal. So we have less resources or fuel in our tank to re-engage in all the things that are important to us. So we need to conserve that fuel, and it's no different in the school environment. We need to be thoughtful on how we're using the fuel and how we're refilling the tank. So here's some strategies that I like to use for keeping the tank full. One is around energy conservation and this idea of the 4 Ps. So if you only have so much fuel to use, how are you going to prioritize it? What are you going to spend that fuel on? Is it a social activity because you really need it? Or is it studying for that math test because it's absolutely essential for you to do well on it? It's making a plan on how you're going to use that energy and how you're going to refill the tank across the day. It's pacing yourself to not do too much for too long and taking adequate breaks throughout the day. And it's positioning yourself in environments that are conducive to keeping that tank full. So again, these noisy, busy, distracting environments are going to use our energy and empty our tank faster than the more quiet, distraction-free environments. Sleep is huge here. So creating a good sleep routine, good sleep hygiene and bedtime routine to make sure we have that opportunity to refill the tank over the nighttime hours. What we put in our body is so important. You know, I always refer to, especially with kids, we talk about being hangry and how do we feel if we don't put the right things in our body? Well, we get irritable and grumpy and upset. And that's just our body telling us that we're running out of resources. So no different when we have a concussion. Trying to tap into some relaxation strategies and practice these. So when we need them, we have them in the school environment. And then both for return to school and return to sport, having some guidelines and staged protocols to help us do that. But I think more importantly, having some people in the school environment in our corner, that point person to help advocate for us and guide any adaptations to our plan. You can find all of these strategies. We're just scratching the surface in a couple of fantastic resources. One from Holland Bloor Review, which is more geared towards parents of young people, but also an equivalent from Sunnybrook Hospital, which is fantastic. That's more geared towards the adult population. So do check those out if you want to look at some of those strategies to fill that tank and keep it full. Another piece I'll just mention rather briefly here is this idea of providing social support and being a good friend to someone with a concussion. This is a big focus of my research program where we're almost looking at social support, not almost, we are looking at social support as an intervention. So can the people around us that we care about and care about us, can they contribute to our recovery after concussion? And I think it's really important in the school environment. We wrote a paper on this, and you can find the link in the PDF as well, where we talked to adolescent females around social support after their concussion recovery. And what we found was three main areas of social support that were needed: emotional support, so building a sense of inclusion and reassurance; tangible support, so having physical supports or services where the school environment that can really come into play; and informational support, so advice and knowledge that can help people understand what we're going through. It did come out in the themes around helping friends with school, sharing notes, helping them carry books and decreasing that physical load, or just helping them get to school. Simple things in the school environment where a friend can be so important, and perhaps more meaningful to have a friend help you out than mom or dad or teachers. Another great tool, well, at least I think is great, that you might find useful as well, is in our School First resource that, again, you can find online. And it's for teachers to just get conversations started to help their students with concussion. So sometimes it's hard to just get the ball rolling and start those discussions with our students. But I think these conversation starters work really great for parents and friends as well. And just thinking about, you know, exploring the preferred future or positive approaches and solution-focused approaches to our discussions, where you can see in the script where a teacher might say, suppose tomorrow you had a good day and you were able to focus in class, what would be different? And the students provided with an opportunity to think about the positives and some of the strategies and needs that they may have. So we've found that these conversation starters can go a long way at just helping youth and anyone for that matter return to the learned environment with the supports that they need, and to do it in an individualized way. Okay, so I want to make sure we have some good time for some questions and discussion. Hopefully that wasn't too fast and furious. And again, lots of links in there for you to build your toolbox and to learn some more. But let me just wrap up with a few take-home points and what I call Nick tips. So one really important piece, and I've said it a few times, but I think this idea of finding a point person at your school, whether it be elementary, secondary school, or post-secondary, or adult learning for that matter, to find someone in that school environment who can be your advocate and who can support you. Oftentimes in the elementary school environment, homeroom teachers or vice principals or principals can be really useful for that. At the secondary level, Guidance counselors can be very, very helpful as well, or vice principals. And I think at the post-secondary level, thinking about the accessibility services offices at our universities and colleges, what we want to be aware of is that point person needs to know the concussion procedures within that school board and that school. They need to be an advocate for you, and they need to help you communicate with all the others involved in your learning. So it goes a long way, but it is a big role for people within those environments. Good news is we are seeing more and more of this in school environments, where schools are identifying key champions within the school environment to best support individuals with concussion. And it's something that we are advocating as much as we can to keep changing that culture. But again, thinking about our laws in place and some of the evidence to support, we're starting to see some implementation of this within the schools, which I think is a great thing. The other is use resources and tools to guide you. There's a lot of amazing work being done in this space, and you've heard about some of it today, but use these resources, see which ones resonate most for you, and bring them to your school and bring them to your teachers and let them know what you're using to guide your journey to get back in the classroom. I just put, again, some hyperlinks for some of the ones discussed today. I'll just highlight, there's one at the end, the last bullet. These are the concussion awareness resources that have been produced by the Ontario government in response to Rowans Law. So I'll just encourage you to take a look at those. There's some really interesting and great resources in there, including some very engaging videos, especially for the younger age groups that might be very useful. And then the last piece, the last Nick tip is really being good to yourself and others. So this idea of listening to your body and knowing and being okay with the fact that there's going to be a few steps forward and often some steps backwards too. And our plan isn't always linear, and there's going to be some adjustments along the way. And that returning to learn can take time, and it does for everyone after concussion. So be good with yourself and set some expectations and goals that are realistic, and that you have the support of others to help you do that. You can't do this alone. You need the support of others to really have successful return to learn. And there's so many people involved in that equation: healthcare professionals, teachers, parents, youth themselves, friends. So the more we can all put our heads together and work together and communicate, I think the better. And then finally, as someone maybe not suffering a concussion, but experiencing the journey of one of your friends or colleagues experiencing a concussion, educate yourself and help them however you can. And I think the best place to start with that and providing social support to someone with a concussion is just having that honest discussion and conversation with your friend to say, what can I do to help you? What do you need? And really take that individualized approach. So a few people to thank, a whole list of amazing funders, CIHR, Public Health Agency of Canada, great collaboration with the York Region District School Board, Ontario Government, Parachute Canada, Holland Bloorview, and of course, my amazing team at the University of Toronto for all the work that goes into these initiatives. But I think most importantly for tonight is to thank all of you. Thank you all for being here. Thank you for the journeys you're leading and navigating with regards to your recovery or supporting those in your lives, whether it be family members, friends, or patients of yours that are dealing with concussion. Again, it takes a village to really do this, and we need to lean on each other. So thank you all. I'll stop talking. We're going to open it up for some questions in the chat and some discussion. Please, please, please reach out to me if I can be of any use. And if you're a Twitter user, we have a few pretty active handles here that get lots of great concussion information out. So thank you all, and we'll have some questions now. I appreciate the time.
Great. Thank you so much, Nick. That was fantastic. We do have a few questions. One of them is, any tips for adults returning to learn?
Sorry.
So anything different, I guess. Is it any different for adults versus children? Sorry, and I'm getting this one from the chat. There's a couple of things in the chat. So
thank you, Leslie. And I think my screen may have stopped sharing, but perhaps not. I did not do that intentionally, but hopefully people, if it did, I'll put my contact information back up in a moment here. But great question. As far as I'm thinking about the strategies from a younger population and then thinking about how do we apply that to an adult population, the majority of the literature to support our approaches to return to learn after concussion are being conducted the research studies are being done in younger populations, but I think certainly the strategies apply to across the lifespan. So thinking about these ideas of having people in your corner, a point person in that learning environment, the 4 Ps of energy conservation and really being thoughtful around how we're using that energy. And also thinking about the accommodations in place in that environment. I think we can certainly apply those. And you can see in our clinical practice guidelines for adults with concussion, the recommendations are essentially identical to the pediatric recommendations. So certainly messages and tools that you can apply to the adult sector for sure.
Great, thank you very much. Heather asks, is Rowans Law only in Ontario? How hard would it be to be Canada-wide?
Oh, that's such a great question, Heather. And, you know, it sort of gets me excited. I know many on this group, and I know Charles Tatter is a huge champion of Rowans Law and really started this. And as of now, Rowans Law is specific to Ontario only. We're seeing the benefits of Rowans Law and how it's such a facilitator to promoting safe return to learn and safe sport activities. There are initiatives and efforts to try to get others on board across the country, territories, and provinces. There currently aren't other laws in other territories and provinces, but there are policies and procedures. I know the Yukon in their education board has some policies and procedures around returning to learn after concussion. And both New Brunswick and Quebec have some protocols that are used both for return to sport and return to play. Return to school. So there are some efforts, and I'm hopeful that Ontario can be that shining light, that example that other provinces and territories can follow, and we can support as many people across Canada as possible.
Great, thank you. And I'll just highlight for everyone, Christian very kindly put your contact information in the chat, so you can find that in there. Doris asks, do you have any suggestions for university level students besides accommodations?
Yes. Well, I think I have lots. I think we could talk a lot about this. And I think aside from the accommodations piece that are the physical changes and the environmental changes within the return to learn and the school environment, I think it's really leaning on those ideas of energy conservation. So what are we doing to make sure we have enough fuel in that tank to feel well? And I think particularly for post-secondary students, life is busy, right? And you're trying to be very independent, and you're cooking dinner and grocery shopping and managing relationships while also managing and dealing with all the pressures of school and sort of preparing for a future career, which is a lot to handle. So I think in the absence of having more people in your corner, like young people may have with mom or dad or other people, it's really important to look within and think about what are the strategies I'm carrying out on a daily basis to be good to myself and to make sure that I have the energy and that fuel in the tank to really do all of these things that are on my plate. I think another piece is thinking about the social component of it. And we've certainly seen, especially with adolescents and also post-secondary students, that we're leaning on our friends more than we might be as young people, as kids, right? And I think really trying to make sure that our friends are educated on what we're going through and share some of these resources with our friends and those we live with and those in our world can go a really long way. I think oftentimes friends just don't know what to do or how to do it. And I think some of these resources that I shared today can be just a great way to get the ball rolling and start that social support that you really need as a post-secondary student.
Great, thank you. From the chat, we have a message, wonderful talk. I have teen patients who show no exercise intolerance, but have complex cognitive, something strange is happening with my screen. Give me 1 second. But have complex cognitive academic issues. Symptoms start only with decoding and learning, unable to attend full school for many months. Is this common to see?
Yeah, I think it can be very common, right? And I think it's dependent on these resources that are available to us. It's dependent on the areas of the brain that are most affected by this twisting and shearing and jiggling of the brain, and where those deficits might be in abilities. And I think we do see this, that oftentimes things seem great from a recovery standpoint, from the physical symptoms and so on, living in sort of your physical world with exercise and so on. But as soon as your brain is taxed really in a complex way cognitively, we start to see those deficits. So I think in short, it is common. And, we do have some ways to go with regards to our interventions to support individuals with cognitive deficits post-concussion. We can learn a lot from the more moderate to severe brain injury world. But we do need to do some of that research to really determine those interventions. And I think in the meantime, really leaning on those compensatory strategies. How do we decrease some of the external stimuli that are going to be using up some of those resources so that we can attend to those complex cognitive tasks the best of our ability, taking the breaks that we need to give the brain and body the chance to refuel and have the resources available to manage that complex information. And think about all those accommodations that could go in place to support that. I think that's going to be really important to promote learning and to deal with and manage a lot of these cognitive complaints that we hear so often.
Great, thank you. Marisa asks, in your opinion, how has COVID-19 impacted the amount of concussions with children, if any? Also, have you come across any pros or cons of online learning with concussion recovery?
Oh, great questions, and so timely. The data doesn't necessarily exist to let us know what are the incidence rates and the differences pre and post pandemic. I think there are some efforts underway to capture some of that. I think anecdotally, what we've seen though is when sports were no longer happening, when there was some shutdowns with sport activities and some of those risky activities for concussion, we definitely saw less sport-related concussions in kids. But what I think is really important is that from Ontario data, we know that only about 30 to 40% of concussions are from sport. And we still continue to see concussions from other causes. And that could be tobogganing or on a trampoline or horsing around with your brother or motor vehicle accidents and all the other ways that concussions can still happen that were probably less influenced or limited as a result of the pandemic. These things were still happening. I think kids during the pandemic were still having concussions, still seeking care. And I think one really important piece is we do know that about 30% of kids with concussion are going to take longer to recover from their injury than their peers that have concussion. So that means sort of these persistent symptoms that can go on for months and months and months and even longer. And we certainly did see that those kids and the issues that they were having with their prolonged recovery, that didn't go away. So during the pandemic, those individuals were still just as needy for those supports in place to help get them to a point where they're re-engaging in the things that matter to them. Related to your second part of the question, really interesting when we pivoted to virtual learning, especially for that group of kids who are already struggling, the demands of virtual learning, I think we all have experienced this, and just the Zoom fatigue and the cognitive overload that we're all experiencing by engaging online all the time. We certainly saw that in young people as well. And kids that were struggling in the school environment were also struggling in the virtual environment, and some perhaps more, depending on what exacerbated their symptoms more. Was it computer time? Was it those types of stimuli versus the real world stimuli and the noise that may have come up in the school environment? So definitely an interesting scenario to sort of think about the impact of virtual learning and engaging online for long periods of time and what that means for symptoms in young people with concussion. So, I'm really keen to sort of see some of those data be generated and get a sense of what that looked like. But I think certainly from an anecdotal standpoint, kids were struggling during the pandemic, still having concussions, and virtual learning for some did cause some additional challenges for sure.
Great, thank you. And just following on that, kids in schools are using computers very often. Any advice for easing the stress caused by computers?
Yeah, so it's something I like to talk about a lot when it comes to individualized approaches to supporting individuals with concussion. And I know we hear often that screen time is a big no-no post-concussion, right? And it can cause a lot of symptoms to get worse and so on. And what I'll say with that is the case in quite a few individuals that have concussion, but not everyone, right? So not everyone is going to have symptom exacerbation after engaging with screens. So I think it's important for us to really take that individualized approach. If screens are bothering you and making your symptoms worse, then we certainly want to address that and limit some of that exposure and have other opportunities to refill the tank and feel well. But if screens aren't bothering you, I think it's something that we don't want to impede someone from their learning because we're making this blanket statement that after you have a concussion, you shouldn't be engaging with screens. So something to consider. And then just in principle, one of those 4 Ps of energy conservation, of pacing ourselves. I think this is important in any context of learning and anything that we're doing. We shouldn't be doing anything for too long. And that certainly applies to engaging with screens post-concussion and really at any time. We should be disengaging and setting our eyes and our focus on something different after periods of time so that we're not doing too much for too long on the screen.
Great, thank you. Any interventions for ongoing challenges with reading?
Yeah, from an intervention standpoint, that's a really good question. I think back to our clinical practice guidelines and what the evidence is telling us. And again, these clinical practice guidelines, we review all the evidence that's coming out around concussion, and we make these recommendations based on that. I can say that we don't have any clear clinical recommendations on reading interventions within those guidelines. Because the evidence isn't quite there or at a level to really tell us this is the intervention that you should be doing. In those situations, I think, again, there's a lot of trial and error with sort of pacing and resting and refilling the tank, but also thinking about those compensatory strategies that might be really helpful to help us engage in reading. That could be reading in different environments, maybe quiet, distraction-free environments allow us to focus more on the reading. There could be some visual interventions. So if we're having some issues with our eye gaze and our eye tracking, perhaps there's some strategies that can be looked at through some optometry or some physiotherapists to really get a sense of, are there some visual challenges that are causing those issues with reading? And then also some sort of age-old occupational therapy strategies of, sort of limiting what we're seeing on our page. So maybe we have a white blank piece of paper that we're tracking down the page with. So we're only reading one line at a time, or at least not looking at an entire page while trying to engage with that content on the page. So certainly some compensatory strategies that we can look into. But I think from an evidence-based standpoint, to really say this is the intervention to use, we still have a ways to go.
Great, thank you. Doris says, one of my clients post-concussion found university doable virtually, but now that class is back in person, the travel time is exhausting. Any suggestions?
Completely, Doris. And I think, thinking about that gas tank analogy, right? So we only have so many resources to use on cognitive or physical activities. And certainly the commute and everything that goes into just getting somewhere physically can really be taxing and have your tank be close to empty before you even begin. So I can certainly see that happening. As far as some suggestions and strategies, and I think you mentioned this was a university student. I think a really important piece for all university students, and I tell my students in the occupational therapy department this as well, is to, if you are in need of any accommodations at all, speak to your graduate coordinator within your department, but also connect with the accessibility services offices to get the proper documentation in order to have some of those accommodations in place. And I don't know if it's possible in this situation, but depending on those supports and the documentation, perhaps there's ways to continue to engage virtually, or maybe look at recorded lectures on certain days where things are worse than others. And there could be some flexibility in that schedule and in the institutional requirements for that student. So definitely, just to summarize that, the accessibility services offices in universities and colleges are there to help, and they'll help students walk through the documentation needs to get the supports that they need in their classes.
Great, thank you. Okay, I think we have one final question, and this isn't school related exactly, it's work, but I'll ask anyway, Nick, because I suspect that you can weigh in. And Beretta is asking, is saying it's hard to work many 12-hour shifts post-concussion. How can I get my employer to understand? And is also adding, what do you think about working night shifts when you're struggling with persistent symptoms after concussion?
Yeah, so this, whether it's the school environment, the work environment, the home environment, sometimes the biggest challenge is just getting those people that you rely on, who make decisions for you, be it your boss, your teacher, and so on, to be aware of what you're going through and some of the supports that you need. Education can go a long way, but that person on the other end of the education has to be open to accepting it and looking at it and then applying that education to support you. I think in situations that I've been involved in where there's been some reluctance from the boss or the teacher or the coach to support some of these recommendations, having some of that medical documentation and supports from a healthcare professional team can be helpful to just sort of really tell your employer that, no, this is a real issue. People struggle with concussion, and I'm one of them. And these are the specific recommendations that my healthcare team is suggesting. So that can be an avenue to take. As far as night shifts, it's a really interesting question. And if you think about that gas tank analogy, it's really thinking about the individual and sort of how are they able to respond, or how are you able to respond to engaging and working at night? There could be some positives there. Maybe the environment is less demanding. Maybe it's less noisy, but less distracting. Maybe public transit is a little bit, or any way to get to work is a little bit less busy and distracting and overwhelming. But the flip side of that coin is some of the negatives might be, maybe you're not sleeping the way you normally would. Your sleep routines might be disrupted quite significantly, which may deplete your tank even further and make it even more challenging to re-engage in that work environment. So really taking that individualized approach, but I would highly recommend engaging with a healthcare professional and getting some supports in place and some documentation so that the employer can be on board. And depending on that relationship with the employer, I shared some great resources today that many of those are easy to digest by all of us. And perhaps that can go a long way to starting those discussions with an employer.
Great. Thank you so much, Nick. That was really helpful. We've got a lot of people indicating that in the chat. So thank you so much for being with us tonight. And thank you for all of you that have attended. Just a reminder, you'll all be receiving a link to a very, very short survey. I think it takes maybe 2 minutes to do, but we really appreciate if you can complete it and just let us know how we're doing, any suggestions you may have for us moving forward. And just a reminder that our next session will be in 2 weeks on March 29th. We're going to have Dr. Carmela Tartaglia, and we're going to be talking about the management of insurance-related issues post-concussion. So thanks, everybody. Have a good night.
Thank you, Leslie. Thanks, everyone. Much
Bye.
appreciated.
Bye.
All the best.